Hi, I'm Dr. Brad Fanistel, and today I want to talk to you about why your brain thinks it is actually helping you by keeping you in pain or in anxiety. But first, I want to remind you that I'm teaching this new way of understanding anxiety and chronic pain based on my own 30-year experience as a primary care internal medicine doctor, seeing patients in hospitals, in ICUs, and in my own medical office. And whether it's a patient on their third emergency room trip in 2 months for headaches or abdominal pain or neck pain or some other problem, or whether it's a person walking into my office telling me this is the fourth antidepressant we've tried and this one doesn't seem any better than the previous ones or something like that. I have watched thousands of people struggle as they've tried to treat pain, anxiety, and depression the old-fashioned way. This is super rewarding for me. Just last week, I had a patient tell me, "Why has nobody told me this before? This has been so helpful for my anxiety." Today's message is that your brain doesn't want you to feel better. Your brain thinks it's doing you a favor by keeping you anxious or keeping you in pain. This is part of what I call the cognitive reframing of anxiety and pain. And this is important because the mind-body tools that I teach in my class and in future videos depend on you reframing your understanding of your anxiety and pain. You're literally rewiring the neural circuitry. I tell people I don't cure anybody. I just show you how your brain works, give you the tools to rewire it. But you have to do it. And when you do rewire it, you'll find that you have not only less anxiety and less pain, but I'm hoping you'll find that you have more control over your nervous system and more control over your life in general. This is super empowering for many, many people. What do I mean when I say your brain thinks it's doing you a favor by keeping you anxious? I mean that your brain's main purpose, its most important function, is keeping you safe and keeping you alive. And there's a large part of your brain devoted to this that is operating completely outside of your conscious awareness, and it runs your body. I describe this in greater detail in other videos, but it is important to understand that there's something running you that you don't have direct control over, and it is devoted to keeping you safe, and this is a large part of your brain that is doing this, and this is happening outside of your conscious awareness. This fight or flight response, which is all anxiety is a good thing when you're in trouble. It's helpful. Let me give you an example. If I'm in a dark alley at night and I hear some footsteps, a lot of things happen. My brain gets a little worried, and because it needs to protect me, it says, hey, I'm going to put you in a little bit of fight or flight right now. That would be useful. And my muscles tense up. That's a good thing. I'll react quicker when my muscles are already tense. And it says, we need some oxygen to be pumping around. And so let me start your heart pumping really fast. So my heart starts beating fast. And I start feeling a gurgly stomach. That's actually a good thing. That's my brain shunting blood away from my viscera, from my stomach intestines. I don't need to digest food right now. And it shunts blood towards my large muscle groups for fight or flight. That's why so many people with anxiety and stress-related issues have stomach problems. There's some real physiologic stuff happening in the body. And also my brain is going, hey, we're about to fight or flight here. We need some oxygen to do that, and I need you to breathe faster. But I'm a primitive lizard brain, and I can't tell you to breathe faster. I don't have any words, but I know how to send messages to the body. I'm going to send a message of shortness of breath. That'll get you to breathe faster, get our oxygen level up, which is a good thing. So there I am in this dark alley at night. And if I turn to my autonomic nervous system, this subconscious part of my brain that's running the body outside of my awareness, if I were able to turn to it and say, what the hell are you doing to me here? This sucks. I mean, my muscles are all tight. My stomach's gurgly, my heart's pounding through my chest, and I'm short of breath. Could you stop this, please? If it could talk back to me, my autopilot brain, my autonomic nervous system would say, I don't give a crap how you feel. I'm not trying to make you feel good here, pal. I'm trying to save your life. This is how I work. I'm making you feel bad to get us out of this situation. I'm helping you. This is just your brain doing its number one job, which is keep you safe. And it doesn't care how you feel. You can yell at it all you want and say, I don't feel good. And it's like, I don't really give a crap. I'm helping us out here. And you know what? This has worked for us in the past. We've had some times where I had to do this and I found it useful to get us out of situations quickly. So yeah, I think I'll just keep doing this. I'm encouraging you to see anxiety for what it really is, which is a learned behavior caused by a learned neural circuit in the brain. I talk about neural circuits in some other videos, but your brain is not your enemy here. Your brain is trying to help you. Once you understand that anxiety is just your brain's way of sending out that scared and protective message to the body, you might start bringing to your brain the same attitude you would bring to a scared child. Just as a scared, freaking out child is kind of unpleasant, so your scared brain is unpleasant. Either one of these could potentially drive you crazy. Who wants to listen to a child screaming? But do you tell her to suck it up? Do you assault her with drugs and yelling and threats to make her shut up? Quit beating up your brain for being anxious. Quit beating yourself up for having a completely normal brain that's using a learned neural circuit to keep you safe. Let's start getting away from the idea that anxiety is a sign of disease or damage and start seeing anxiety for what it really is. A kind, loving brain that is scared and has gotten a little too overprotective. I review the different tools and exercises that can help start rewiring the scared brain in the classes that I teach online and in future videos. If these ideas resonate with you, I hope you'll listen to that inner voice that is telling you that this kind of makes sense and continue down the path of exposing yourself to this different approach to anxiety and chronic pain. I've listed some of my favorite books in the description in this video below, and congratulations on starting to try to take control over your own nervous system. There is a way out for many, many people. All neural circuits are rewirable. It's called neuroplasticity. And this different approach is what I see helping so many people who have struggled for years, treating their pain and treating their anxiety the old-fashioned way. Thanks for listening. I hope this has been helpful to somebody out there. I'm Dr. Brad Fanistel at BoulderMindBodyMedicine.com. See you next time.